Morning is Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division. He has been joining us every single morning on Sunrise for the last 2 months to give us an update on the coronavirus. And he joins us once again this morning. Dr. Kothary, thanks so much for joining us.
Oh, thanks once again for having me, Alex.
I want to begin a little bit first by talking about the letter that was sent to the governor's office that was signed by many county officials as well as several hospital staff members from across Kern County. Your name is on that list that signed that letter. Let's just talk a little bit about what that letter entails and why you believe the county, Kern County, is in a better position to slowly reopen faster than other counties in California.
Well, so we had two really sticking points with the phased approach for the governor that was set forth by the governor. One was we had to have less than one death per 10,000, and the other was we had to have zero deaths in the 14-day period. The issue with one death per 10,000 would mean we'd have to have less than, or one case in 10,000 would mean we'd have to have less than 90 cases in a 2-week period, which is very, very difficult to do in our county, especially if you open up the testing availability here in Kern County. We now have 10 new test sites here. And so what we're going to see is we're going to see a lot more positives because we have a lot more asymptomatic patients. What we recommended instead is that instead of the number of cases, we'd change it to the number of hospitalizations per 10,000. And we'd leave the number of cases, the number of death cases, the same as long as they'd been all come from one facility.
Now, of course, a lot of counties in California are showing signs of improvement. It's really interesting to look at the difference between Southern California and the Bay Area. For example, in the spring, early March, late February, you may remember that that was the center of the outbreak in the United States. Now things look a little different. The Bay Area is starting to see some improvement, while Southern California, especially LA County, is getting hit very hard. What do you make of all of this as the country starts to move forward to reopening?
That's something we have to anticipate is, are we going to have a second surge in the fall, in the summertime? I don't believe we'll have a second surge in the summertime. I believe we'll have a second fall in the wintertime or the fall time. I think what's going to happen now is as the weather warms up, we'll see the number of cases decline slightly, but I think you'll see still a new norm out there in terms of how people interact with each other. At restaurants once they open up, I think you'll see that social distancing being practiced. I think you'll see the waiters wearing masks and things like that.
I think what's interesting, you talk about possibly, when we've heard this for several weeks, that there could be a resurgence in the fall and winter. We hear this, the possibility of there being a second wave, at the same time as many doctors, even on the from the federal government, from the CDC, say that there is promising results that show that a vaccine could come as early as later this month into I'm sorry, later this year or early next year. What are your thoughts on that, especially as this new news is coming out?
I really think, a vaccine would be ideal. However, the vaccine is not going to be curative. It's going to be very similar to the one we have for the flu. So, it won't prevent the flu altogether. But if you do get the case of the flu, your symptoms will also be mild. I personally don't believe there's going to be a vaccine this year. I don't think it comes out till 2021. I just think there's so many different variables, and this virus will continue to mutate like the flu viruses as well.
So you think, well, let me ask you, do you think that the second wave in the fall and winter could be a little stronger here in California, since we, of course, start to cool off when the temperatures start to drop? And do you think it's going to be spreading more, at least in our neck of the woods?
I think you'll see a very similar trend. The East Coast will have, places that have a lot of people living together will be hit the hardest, and then it'll move out west. But I think, one of the things that we're doing is we now know how this virus works. Right. We know how it infects people. We know what we need to do. So we're all going to be prepared at the hospital level for sure.
All right, Dr. Kothary, thanks so much for joining us this morning, answering our questions. We'll see you tomorrow.